Afternoon, everyone, most especially to our professor, Ma'am Jacqueline Macahis. I am April Joy Espartero Liquigan from Costa Rica Elementary School in Calamansig District, your reporter for today. This afternoon, I will be discussing prostitution and sexually transmitted diseases, the types of prostitution, and its effect. Buckle up and we're ready to go. According to Father James Rauter, SG, the tragedy of the Philippines is this. In one of the world's loveliest countries, some of the world's most beautiful girls are being sold for money to some of the world's ugliest men. What is prostitution? Prostitution involves the selling of sex. Okay, it means that money is the key feature of prostitution. Money is also the major motivation for women who becomes prostitute, as most of them come from a low-income background. Many people, and especially those with conservative religious views, believe prostitution is immoral. Why? It is because it involves sex for money, and they considered prostitution a sign of society's moral decay. Many feminists believe that prostitution is degrading to women, and it provides a context in which prostitutes are robbed, beaten, and or raped. These two groups of people might agree on little else, but they both hold strong negative views about prostitution. There are several types of prostitutes exist. Okay. First is the street walkers, or it is also called as street prostitutes. It is a form of prostitution in which they find their customers somewhere on a street or in a public places such as in the parks or in the benches. Then they have a quick act of sex in the customers' cars, in an alleyway or other secluded spot, or in a cheap hotel. Second is a call girls. Okay, they work as an independent operators in their homes or fairly fancy hotels and charge a lot of money for their services, which include sex but also talking and dining. And then their clients are typically businessmen or other wealthy individuals. Third is the escorts. Work for escort agencies, which often advertise heavily in phone books and on the internet. They may operate out of an apartment rented by the agency or come to a client's hotel room or other location. Although they may actually act as an escort to dinner or show, typically their services include sexual acts. They too are generally well paid for their works but do not earn nearly as much as schoolgirls because they have to give at least 30% of their earnings to their agency. The call girls and escort rank at the top of the prostitution hierarchy. And the next is the brothel workers. Workers in these brothels pay income tax because their employer requires regular health exams and condom use. Next type of prostitution is the massage parlor workers. As their name also implies, work in massage parlors. Many massage parlors, of course, involve no prostitution at all and are entirely legal. And then, however, some massage parlors are in fact prone of prostitution, where the prostitute masturbates a man and brings him to a what is often termed as happy ending. A final category of prostitution involves prostitutes who works in bars and then the casinos or similar establishments. They make contact with a customer in this setting and then have sex with them elsewhere. We will proceed now to the effect of prostitution. First is sexual violence and physical assault are the norm for women in all types of prostitution. The second effect is that health problems such as exhaustion, viral illness, STDs or the sexually transmitted diseases, vaginal infections, backaches, sleeplessness, and depression. The third one is the post-traumatic stress disorder. And the fourth effect of prostitution is prostituted women are at a higher risk of being murdered. Now let us define if what is the sexually transmitted diseases. It is one of the effect of prostitution, and we will discuss also the types of the sexually transmitted diseases. So, sexually transmitted diseases, it is also referred to as sexually transmitted infections or STI, and venereal diseases VD are illnesses that have a significant probability of transmission between humans by means of sexual behavior, including vaginal intercourse, anal sex, and oral sex. Some STI can also be contracted by using IV drug needles after their use by an infected person, as well through childbirth or breastfeeding. First type of sexually transmitted diseases is the chlamydia. So this is the cause and manners of transmission. The cause of chlamydia is the bacterium transmitted via oral, anal, and vaginal sex. So the symptoms of chlamydia for women, so there is an abnormal vaginal discharge, burning during urination, and bleeding in between periods, although most women do not experience any symptoms. And then for men, there is a pain when urinating, an abnormal discharge from their penis. So the effect is chlamydia can infect the urinary tract and potentially lead to pelvic inflammatory diseases. So the chlamydia, it can be treated by antibiotics. So matreat yung chlamydia. Second types of STDs is the herpes or the herpes simplex virus or HSV. So cause and manners of transmission. HSV-1 acquired orally and causes cold sores. Then HSV-2 acquired during sexual contact and affect the genitals. Then it is spread through skin contact with a person infected with the virus. So the symptoms for the herpes or herpes simplex virus or HSV is most individuals infected with HSV-1 or HSV-2 experience either no symptoms or have very mild symptoms that go unnoticed or are mistaken for another skin condition. Because of this, most people infected with HSV-2 are not aware of their infection. When symptoms do occur, they typically appears as one or more blisters on or around the genitals, rectum, or mouth. So the blisters break and leave painful sore that may take 2 to 4 weeks to heal. Experiencing these symptoms is sometimes referred to as having an outbreak. The first time someone has an outbreak, they may also experience flu-like symptoms such as fever, body aches, and swollen glands. Another type of STDs is human papillomavirus or HPV. So cause and manners of transmission can be passed through genital to genital contact as well as during oral sex. Symptoms of this is most people with HPV do not develop symptoms or health problems from it. In 90% of cases, the body's immune system clears HPV within 2 years, but there is no way to know which people who get HPV will go on to develop health problems. Next is gonorrhea. It causes and manners of transmission as sexually transmitted diseases caused by a bacterium gonococcus. Gonorrhea can grow easily in the warm, moist area of the reproductive tract, including the cervix or opening to the womb, uterus or the womb, and fallopian tubes, egg canals in women, and in the urethra, urine canal in women and men. The bacterium can also grow in the mouth, throat, eyes, and anus. Can spread through contact with the penis, vagina, mouth, or anus. Next is syphilis. Syphilis is a sexually transmitted disease caused by a bacterium, a corkscrew-shaped microorganism called Spirochaete, which enters the body through mucous membranes or breaks in the skin. After rapid multiplication, the germs are spread throughout the body by the bloodstream and the lymphatic system. And the trichomoniasis or trich, a very common sexually transmitted disease that is caused by infection with a protozoan parasite called Trichomonas vaginalis. Although symptoms of the disease can vary, most women and men who have the parasite cannot tell they are infected. The parasite is passed from an infected person to an uninfected person during sex. In women, the most commonly infected part of the body is the lower genital tract, the vulva, vagina, or urethra. And in men, the most commonly infected body part is the inside of the penis, the urethra. During sex, the parasite is usually transmitted from a penis to a vagina or from a vagina to a penis, but it can also be passed from a vagina to another vagina. It is not common for the parasite to infect the other body parts like the hands, mouth, or anus.